Hi, my name is Dr. Vicki. I'm a family medicine doctor in Rockwall, Texas, and I see so many patients that come in complaining about stress. Stress is a normal reaction to life events. It's when you feel that life demands more of you than you're used to being able to handle. Things just get overwhelmed. Some stress is really useful. You can use it in order to motivate yourself to get projects done, in order to stay up and meet a deadline or to study for a test. But stress that occurs too often can lead to problems, both mental health problems as well as normal daily activities can be difficult. It can also weaken your immune system and increase your risk for multiple other physical illnesses. If you already have a medical problem, stress can really make it worse, such as inflammatory arthritis or bowel disease. So causes of stress, all sorts of life events may cause stress. Any event in one's life that is difficult, that is either positive or negative. So like the birth of a baby is one that definitely is a big stressor. But other negative things like losing your job or having to move, these can be very disturbing and lead to a lot of difficulty and stress. Less obvious life events can also cause stress. Things like working long hours, having to drive in traffic, caring for small children. These things can definitely lead to a lot of ongoing stress. So stress basically shows up in multiple different symptoms. Sometimes with anxiety, where you're fearful of things, you're afraid all the time, you're constantly on edge, overwhelmed, or out of control. Sometimes anger, being irritated or impatient. It can be in the form of depression where you feel sad, down, have a lot of guilt feelings over things. Other people just can't concentrate. They have difficulty focusing, remembering, not able to make decisions. So stress can also cause a lot of physical complaints, aches and pains like headaches or neck pain, just joint aches in general. You can have a lot of tight muscles. People will grind their teeth or clench their jaw. And then others complain about being tired, either having difficulty sleeping or just being fatigued even though they get a good night's sleep. Stress leads to a lot of unhealthy behaviors, and this is what I get involved with a lot. People that are gaining weight, that are overeating because of stress, or those that are losing weight because they're skipping meals. Some can't sleep and they lay awake with their thoughts racing at night. Others just can't get enough sleep, so they're falling asleep driving to work, or they get tired in the afternoon and can't get their work completed. Often people start working too much so that they overcompensate, and you've heard of the workaholic syndrome. Others procrastinate. They just can't get anything done, so their difficulty focusing starts to interfere with their getting their work completed. Others start really reckless behavior, like drinking excess alcohol or using drugs in order to kind of mask their stress and to feel better. Some people will start smoking heavily and chain smoke in order to help deal with their stress. So the diagnosis of stress is usually made by a healthcare provider. They'll ask you questions about your symptoms and any stressful life events. They'll also ask about your medical history and may order some blood tests to just rule out other causes for your symptoms. Certain medical conditions and medications can also lead to these same symptoms, so we have to rule those things out first. So mental illness can cause a lot of emotional symptoms and unhealthy behaviors that look very similar to other stress conditions, or a prolonged stress can lead to a more serious mental health condition. So it is important for you to see your healthcare provider if your symptoms are significant, and just to do a baseline evaluation and make sure that all you're dealing with is just general stress of life. The treatment is stress management, and this is lots of just things that we all learned about in kindergarten. The goals of stress management are to reduce those stressful life events and cope with the stress that is in our life that we can't get rid of. So just stress identification, taking a look at your life to see where the factors are that are leading to your stress. Is it the responsibilities at home or at work, or things that are within your control that you could decrease, such as volunteering or being overactive in sports or athletics that are taking up your time? Or is it some conflict with a boss or person at home that is leading to a lot of stress, and maybe some counseling or other things might be helpful for. Just time management, being able to set priorities, to keep a calendar of events and learn to say no to unnecessary or other demands on your time. These can definitely help you focus on the things that are most important to you. The next thing is some counseling can be helpful. You can learn to rethink the problem, try to think realistically about stressful events instead of ignoring them or overreacting, just to understand that stress is part of a normal life, and that can be used to help grow us and learn other avenues and ways to deal with those trials that everyone faces in life. Exercise can definitely be helpful as a stress manager. They recommend 30 minutes of aerobic exercise 5 days a week. And this can be either at home with a brisk walk or an exercise tape, or more formal with a trainer, or going to a gym and doing a more intensive type of program. Relaxation techniques can be very helpful. Definitely learning yoga, meditation, Tai Chi, deep breathing exercises can be very helpful. Just listening to music, taking a bath, journaling, anything that you find relaxing. Some hobbies can be very relaxing, such as doing crafts or enjoying instrument. Lots of other things can be used by the individual to help decrease those stressors. Healthy lifestyle. This just includes a balanced diet, making sure that you're eating plenty of fruits and vegetables, getting regular sleep, getting to bed at the same time every night, and making sure that you're staying asleep for a minimum of 7 to 8 hours, and then not oversleeping and taking frequent naps. So trying to make yourself stick to a regular sleep schedule. The other things are just looking for those strong support, those people in your family, friends, at your church, that you can talk to, that you can relate with, that can be motivators and that can help you stay positive. It also important to learn how to express your feelings and to let other people know that you're struggling. So something just about being able to talk about it does seem to make a big difference with getting through and learning from other people's experiences about what has been helpful to them. It's also really important to avoid using excess alcohol and to avoid all drugs that can be abused in order to try and relax. These things just escalate and cause more stress and have other health negative side effects that you just don't want to enter into when you're trying to improve and decrease stress. These other substances can definitely heighten the stress and cause more mood, irritability, and sleep disruption. So it's really important that if you're having serious stress-related symptoms, or that you might have an underlying mental health condition, that you see your provider in order to really evaluate this and make sure that you get adequate treatment. But hopefully that some of these hints are helpful in getting people started and living a more healthy and happy life.